Hello and welcome to part 2 of our 4-part speaker series titled Mapping a Monster, Making Sense of the COVID-19 Data Through Geospatial Technology. This program series is hosted by the Johns Hopkins University AAP Geographic Information Systems program. My name is Dr. Cassandra Hansen, and I'm the program coordinator for the GIS and Environmental Science and Policy program. I've provided a URL for more information about our online GIS Master's program and GIS certification options. Our overall goal of this speaker series is to highlight cutting-edge geospatial practices in the use of epidemiology from past to present. We organize the speaker series to bring together professionals in the GIS industry who are using geospatial technologies, analysis, and visualization to support a variety of pandemic web maps, graphs, and applications used to raise awareness, provide information to public, and help with public decision making. As a note, we'll not be recording our first presenter due to copyrighted content, but we'll go ahead and jump into a little bit of an overview about the geographic information systems. For those of you who may not be familiar with GIS, GIS is made up of 4 components. That is made up of data, maps, analysis, and application output. All 4 play a critical part in communicating information. Remember that providing a solid data collection in a simple map or app representing what is known is an overall goal for any GIS professional through the use of data collection, analysis, map creation, and apps. In part 1 of our speaker series, we highlighted how GIS has been leveraged as a powerful data visualization and analysis tool for making decisions based on science and facts that have helped real-world consequences, emphasizing the global impact and with the use of the famous Johns Hopkins COVID-19 dashboard. Today, we're going to take this conversation one step further and address how historic points, lines, and polygons have a big impact over past and present decisions, as we see here on our screen with one of the most famous maps that was created for epidemiology. This simple map with points and lines illustrates deaths, number of deaths due to the outbreak of the cholera outbreak in England in 1854. This map was created by Dr. John Snow. Again, remember that providing a solid data collection in a simple map or app representing what is known is an overall goal of any GIS professional through the use of data collection and maps. Part 2 is titled The Decision, and part 2 focuses on the historical aspect of past pandemics, how we map them, how we interpret the information in the form of cartographic visualization, and how these past pandemics can help states and local organizations make critical decisions. For part 2, we bring together speakers Martin Gamache from National Geographic and Paul Doherty from the National Alliance for Public Safety GIS, known as NAPSG Foundation. At the end of each speakers, we'll have time for questions and answers, so please save those questions. You can post them in the chat box, and I'll be able to direct those questions to our speakers if time permits. With that said, it is my honor to welcome our first presenter, Martin Gamache. He's the director of Cartography at National Geographic. Cartography is the language of social and physical sciences, and done correctly, it creates an extremely important map to communicate complicated information. If you found yourself lost in awe looking at a beautiful National Geographic map, chances are you're staring at one of Martin's creations, a true master of his craft, finding elegant solutions to solve complicated problems. Martin, welcome. Thank you so much for presenting today. At this point, I'll have you go unmute and go ahead and grab the control options. Our second presenter, Dr. Paul Doherty, is the Director of Technology and Innovation at National Alliance for Public Safety GIS, NAPSG Foundation. His background involves the integration of GIS workflow and application for search and rescue and first responders. I would describe Dr. Doherty as the map Batman for disaster response. His fast-moving geospatial skills, the behind-the-scenes assistance, are usually he's usually one of the first to jump on a disaster and helping out for those folks doing GIS work. disasters involving wildfires, tornadoes, earthquakes, and search and rescues. Paul's always there and always willing to help out. He's been an instructor, an adjunct instructor at Johns Hopkins in the GIS program. And so we're really happy to have him back. Welcome, Paul. Thank you so much for speaking with us today. So I'm going to go ahead and turn over the controls to you.
All right, thank you. I've been called a lot of things, but never Map Batman. Well, thank you, Dr. Hansen, Cassie, as I know you, for this opportunity to speak during the series. I also want to thank Martin for an enlightening talk. It's always a challenge to follow up National Geographic. The maps are so beautiful, and more important, like you mentioned, the stories are so compelling. And so I really appreciate the opportunity to collaborate with you here. And I hope I do your talk some justice. So to build off of where Martin covered, I think a key message is that we must look to our past and learn from it. If data were not collected and visualized in 1918, we would be much less prepared 100 years later dealing with similar, at least seemingly similar pandemic. But let's go a little further back. And here's the example Dr. Hansen mentioned from 1854. You may have heard this story before if you're in geography or epidemiology, so let me just summarize. In a cramped Soho neighborhood, teeming with people and animals living in cramped and dirty quarters, a deadly outbreak of cholera is spreading. Doctors and scientists are thinking it's bad air. They theorize it's particles from rotting matter, which all sounds really reasonable, but enter John Snow. Not a map Batman, not a GIS person, but an accomplished physician. He becomes convinced that something other than the air might be responsible for the illness. And through carefully mapping the outbreak, he finds that everyone affected has a single connection in common, and that is the famous Broad Street pump. So in September 1854, Snow tests this theory, removes the pump's handle, at least as the legend goes, and effectively stops the outbreak, and very important to scientists, was able to support his theory and open the door to modern epidemiology. Now, I don't know the whole story. I would argue he probably wasn't alone. He was probably working as a team. And even today, we're a part of his team because we go back and look at those maps and think about how GIS or geospatial geographic information systems could be used. And I would like to say, there's a great pub right outside the Broad Street Pump if you're ever in the area. Jared, my colleague, and I were able to visit it this summer and confirm that the location has moved, but that there is a great pub environment right next door. But more important than that is, who are the John Snows of today? These are the faces of just a few people who go above and beyond to serve their communities before, during, and after COVID-19. These are GIS specialists that embed themselves as part of the public safety and public health community. And not only do they make maps, they teach others how to think spatially and make better decisions, and ultimately to enhance outcomes for survivors impacted by disasters. And each of these people have a story and a team that they work with, but I just wanted to remind everybody that it's not just about the maps, it's about the people. So going back to the title of this series is, making sense of COVID-19 data through geospatial tech, and how did they do it? And I'd like to share a little bit from my perspective. I'll start with speaking briefly about the organization I work for and the community we support. I'll dive into the topic of geospatial game plans. Next, I'll highlight some examples of COVID-19 innovation. And if you want to take a short break and just come back at the end, I'll talk about what you can do to actually get involved. And I think that's what's really important. So a little bit about the National Alliance for Public Safety GIS Foundation, NAPSG Foundation, is, I work for this organization and we're a nonprofit organization, and we really, more than an organization, we're a community. We have a vision. It's a nation of emergency responders and leaders equipped with the knowledge and skills in applying technology and data to change the outcomes for survivors. And I think this is a common mission, not just for NAPSG Foundation, but there's organizations that we work with around the globe. And we really believe that this is possible by ensuring first responders, operators, and decision makers have access to the right information at the right time and making it actionable. So who is this community? 20,000 members across the US and growing beyond our borders. It's an interdisciplinary network, and that's really important. And we all have a common vision, and it's really exciting to meet with all of you again someday in person, but many of you are here now virtually, and so it's good to say hi. As NAPSG staff, our core team, our approach is founded on building national guidelines and standards, facilitating exercises and simulation, education and training, and transferring knowledge and skills, which is part of why I'm here today. But really, we try to build off a foundation of best practices. In the end, our team plays a really small, minor role. It's all about the community that's out there working with agencies doing the good work. So next, let's talk a little bit about those people and some of the tools they use. Let's discuss what is this topic of geospatial game plans and why is it important? So first, it starts with the team. In public safety, this will include first responders, emergency managers, and even the public, or I should say especially the public. For COVID-19, now we're adding new people into the mix, and that's a good thing, public health officials and data scientists. Next, we need to work with our team to identify what are the core information needs. Core info needs are the information that you know you'll need to make decisions during an incident. And finally, we need a game plan that involves people, process, and technology to support all of these decision makers. It's a human-centered approach. It starts with the team, but it's also meant to be agile and innovative. So let's jump into a little bit of an example, maybe through a hypothesis. If the information needed to make decisions, core info needs, are identified in advance, then our tools can be designed in advance. And if our tools are designed in advance, then decisions will be made more effectively, leading to a more positive outcome for survivors, as we discussed before. Here's a graphical example of a tornado geospatial game plan. And I'd like to pull up a little more of a dynamic example for those of you that may not be familiar with tornadoes. So for severe weather events or tornadoes, we often are looking at a long-term outlook. We're not waiting until a tornado is at our doorsteps. We're paying attention to information like National Weather Service Storm Prediction Center. We don't wait to find this information. We know exactly where it is, and we design our tools to highlight it in advance. Lost my map here. Next, the would-be red areas on the map. Thankfully, there's none today. These are long-term watches and warnings from the National Weather Service, and we monitor these as we're getting into the next 24 hours closer to an event. And then likely soon, are short-term warnings from the National Weather Service. And if we're seeing these on a map and we're in that area, we're often receiving alerts on our phone, and that's a trigger that a tornado is imminent. Once tornadoes have already occurred, here's some, this is actual data in Ohio and Pennsylvania. Little icons can show up on the map and show us where trained observers have observed tornadoes within minutes after seeing it. I also work closely with the NAPSG Foundation and GIS Corps and Cedar Digital team to quickly map photos after tornadoes, hurricanes, and earthquakes. But in this case for tornadoes, those early photos can be used to determine the estimated track and maybe in some cases swath of a tornado, like I said, just minutes after it happens. And then, you know, I need to know where I'm going to get the official data on the impacts and where the tornado's gone. And we go back to the National Weather Service for those tornado tracks. All of these are layers and they all play a key role in our geospatial game plan. And maps like these or applications like these are just a part of your toolkit. We have examples of geospatial game plans that you can download, and I'll make sure are available through the links. The most common example is just a PowerPoint slide deck that walks you through some of the different elements of a game plan. And then we're providing interactive examples wherever possible. And this is a new initiative we're working on, so we really look forward to your feedback. You can even leave little comments below. So this approach that we use for something like a tornado or a wildfire or a hurricane, these approaches can be used for pandemic planning. However, the reality is very few, if any, agencies had a pandemic geospatial game plan in advance of this disaster, at least not to the detail that we would something more common like a tornado or an earthquake. And, you know, here are some ideas, some things we're trying to work out on the fly as agencies across the United States is what's our game plan for early detection, case reporting, personal protective equipment and shortages, testing sites and results, new information like social distancing and mobility, and it keeps growing, right? The reemergence of the disease, as someone mentioned before, economic impacts, and really technical things like where are we going to shelter people during disasters going forward. Agencies across the world, and especially in the United States, we're all trying to figure this out right now. And we talk a little bit about how we're trying to be more prepared in the future. So despite the fact that many agencies did not have a pandemic geospatial game plan, were they still able to adapt? Well, to answer this, let's look at some examples first. Probably the number one topic or workflow that came up early on during COVID-19's emergence in the United States was, how are we going to map the cases? For most organizations, it starts with public health data, which carries with it genuine privacy concerns, which really limits access. This access constraint is addressed by most agencies by using aggregation and anonymization of public health data to make sure that privacy is not violated. Once this is done, and hopefully done in a way that streamlines the process, these data can be pushed into decision support tools. And finally, really important, can be disseminated through internal websites, but probably just, or even more important, into public websites, which is critical for transparency and trust in communities. And this diagram makes it look so easy, but there's so many approaches to it, and many of us, it was the first time. I won't dwell on this. By now, you've probably all seen the Johns Hopkins dashboard. They had to work out their geospatial game plan, and from the stories I hear, very rapidly. This is not something they had built just waiting for data. But you may not have seen the wide variety of applications from across the country. Here's a map we made, NAPSG Foundation, to just highlight all the state level resources available. And I'd like to highlight one example in particular. So you'll have access to this link. It's sort of a map of maps. And I just wanted to jump into the middle of the country to Missouri and highlight one particular example. All of these states in green have examples that you can draw from. So Missouri, and this wasn't on day one, but over time, they built out a centralized website where you could access information all the way from the classic case reports, looking at things like confirmed cases and change over time. And like many other topics we talked about, not just the cases, but the death and the recovery and hospitalizations. But they also are making available data about things like social vulnerability and economic impacts. And so here's an example from St. Louis looking at what are the most vulnerable populations. So not just mapping the disease, but what is it that we can do about it? And they're releasing most of these resources publicly, which I find really commendable. And there are so many examples, but I wanted to remind people that these incidents, while storing data centrally, statewide, is very useful, the incident starts and ends locally. And so looking at county examples is really intriguing, getting into more detailed data, like on the Sonoma County website, where they're mapping total cases by date, and you can actually see it at a much smaller area, the impacts of COVID-19. New York City, my hometown, was actually criticized very early on for not sharing data. I wasn't there, but my guess is they were likely building this airplane as it was flying, like most organizations. Eventually, they were able to open up maps and data. And what I'd like to point out here with this simple map is that it's the importance of going beyond mapping case counts and into case rates. For those of you geography and epidemiology students, mapping just case counts can be misleading due to variations in population density, especially in a place like New York City. Next steps to improve local mapping of COVID-19 and other pandemics is actually to map using grids or hex bins. Zip codes lead to potential misconceptions about the geography of the disease, and I'll leave that for the cartographers to explain, but it's really important to think about the story you're trying to tell, like Martin had said, and making sure your map represents that. So those were just some examples from across agencies, but I also wanted to briefly touch on some other workflows and core information needs like mobility data. During this event, organizations like Facebook and Unicast and Blue Dot and SafeGraph and Google and many academic institutions all came together through the COVID-19 Mobility Data Network. And here's just a simple map I'll make available to you that allows you to compare some of these movement data sets. These are anonymized and aggregated movement of people, but it's raised a lot of attention in understanding both social distancing on the one end, but also economic impacts on the other. And this is a new field or really emerging field that we've not seen so prevalent inside of public safety before. So in other cases, we want to look not just at COVID-19 or how people are moving. We want to understand, are we prepared to deal with this? And many organizations like the International Association of Fire Chiefs were able to reach out to their constituents and geo-enable the information so they can better understand impacts. One of the biggest stories was, are we going to have enough personal protective equipment, or PPE? And, like any good case, the fire service starts it off and then the police follow. But, in law enforcement, they're dealing with the same challenges out in the field and looking at, we're losing boots on the ground due to COVID-19 in a way maybe we weren't expecting, due to shortages or exposure, or because it's just all new. And so it's really important to remember that we're also trying to understand how to do things better, not just map the disease itself. And probably one of my favorite examples is in March, actually March 19th, the ESRI Disaster Response Program requested the GIS Corps' assistance in helping to fill a critical information gap that you're hearing from agencies across the US. The first task for creating was really to create a nationwide layer of COVID-19 testing site locations. There was no centralized database set up at a national level, and certainly not much going on at a state level. So this data set was volunteer powered. It's openly available to governments, healthcare providers, and the public. And over 500 volunteers from the GIS Corps have responded, and they're mapping and updating thousands of these sites daily. I believe the GIS Corps is still accepting new volunteers for this project. And if not, they're always accepting new volunteers and posting new missions. And so if you've got some geographic, cartographic, or even data science skills, I encourage you to go to the GIS Corps website and sign up. It's one of the ways you can get involved. And then going down to a really local level, cities and towns and suburbs and rural communities, they have very real concerns, not just about the virus itself, but the economic impacts. The city of Nashua in New Hampshire took an innovative approach to engaging local businesses. They created a tool so businesses could report if they're closed or when they're opening, changes in hours, and if they're providing alternative or online services, things that might be hard to explain from sticking a flyer on the door. And so this is just a sweep of examples. Next, I'd really like to highlight one particular team and their approach. And this team is very special, but I imagine it's replicated across the world. But the city and county of Boulder, in response to COVID-19, they formed a team that included, most notably, a brilliant data scientist, Lee Benson. This team is still growing and pulling expertise from the region. And of course, they're doing it, like most of us, virtually, right? They can't just all cram into an emergency operations center. They're working like all of us to collaborate in a virtual environment, and it allows them to actually grow their team fairly rapidly. Well, a little bit on the inside here. I've worked with this organization for a while, and I've watched them. And since the 2013 floods in Colorado, they formed a situational awareness section that uses geospatial applications and many other tools to answer key questions for their Emergency Operations Center, or EOC. Applications are prepared in advance based on core information needs of the EOC. And as I hear from the GIS specialists, they're always refined during disasters. The GIS specialists, and this is important, are a core part of this EOC team. They came up with a geospatial game plan for COVID-19, and in this plan, they wanted to approach the core information need of early detection. Next week, they're giving a technical presentation, but here's just a quick summary. They used anonymized 911 call data, fed it into natural language recognition and aggregation, and this helps to identify the concentration of keywords from 911 phone calls. So not going through it and listening to each one, but actually automatically highlighting keywords. They use a series of data science and spatial statistic tools, and then they feed this information into decision support tools to help decision makers. And decision makers have a critical role in actually designing this process and the tools they use. Spatial statistics plays a key role in understanding the where and when of COVID-19. And so once data is taken from natural language, from raw data into data, it can be used with a wide variety of space and time hotspot tools and other geospatial analysis. But why is this important? It's a paradigm shift from mapping simply what has happened to understanding what might happen next. They're able to go back in time now and understand really when did the disease emerge in their community and how can they do better next time, and how can they actually use this across any other pandemic or really incidents involving their community. And so really simple decision maker tools. There's a lot going on behind the scenes, but this helps them to make decisions quickly, anticipate what might happen next, and try to prevent or really enhance the outcome for survivors. So in conclusion, before we get into what I think you can do, let's just stop and say, what do nearly all of these organizations have in common? And I wish I could just ask you and get some answers, but I'll just tell you, they prepare in advance for disasters. They include geospatial as a core component of their readiness, response, and recovery. That sounds really simple, but there's a process, right? Identify your core information needs, build your team, and have a geospatial game plan and work together. The teams that were able to have a game plan for existing hazards were better able to adapt to COVID-19 response and continue into recovery. And one more key note, and it was most notable in this disaster, is you have to make the data available. Organizations that shared their data available openly had more support from data scientists and gained trust from the public, right? Help yourself by sharing the data, and I think that's really, really important. Couple of key messages for students and educators. If you're a student, geography matters no matter what your industry, what industry you go into. I think you should have some foundational understanding of geography and geospatial tools. Develop interpersonal skills. This is a tough one. They'll help you everywhere you go, and maybe it's not natural for you to be an extrovert, but then find someone who is, that understands your work, and work with them as a team to make change. You have to be able to get the word out about what you're doing. Form interdisciplinary teams early on. Doing this early on in your education prepares you for any environment that you can adapt to. If you are already a geography or geospatial focused major, I'd still encourage you to go find an industry you love. You can become a generalist later in life, but if you apply problem solving to some specific problems, I'm a little bit biased to public safety, you'll hone your skills and you'll better understand the world around you. Adopt current technology. This is really hard for academic institutions, but by staying current, you can use the concepts as foundation, but you're using technology that already exists so that when students leave, they can make change, and that's critical. And get involved. Volunteer if you don't have the job you want, if you don't feel like you're making an impact, or even while you're still a student, especially in these uncertain times. I think volunteering and digital volunteering is a great way to get involved. So what's next? I want to give you a little more about what I think you can do. First of all, the private sector played an enormous role in the early response to COVID-19. And this is just one example, but special thanks to Esri. Esri's made COVID-19 specific learning tutorials available, freely available. And you can see there's a wide variety of skill levels and time needed to look at these. And they also provided some of the earliest tools for helping to map case rates for GIS specialists who had never done it before through their solutions program. Now, in May 2020, NAPSG Foundation, the National States Geographic Information Council, or NSGIC, and the Urban Regional Information Systems Association, or URISA, joined forces to establish the National Pandemic GIS Task Force, which sounds really cool, and it is. And what Rebecca, our senior director, and others are doing through this task force is to provide thought leadership, expertise, and governance across public safety and technology in the GIS community. They're engaging the public safety and public health communities. They're facilitating the development of COVID-19 technology and a GIS after action review, and coordinating amongst emergency management, public health, technology, and advancing consistent use of technology so that we're more prepared for whatever pandemic's next or whatever is left over for response here in COVID-19, as we're not out of the woods yet. Developing a standard playbook for integrating GIS into pandemic response and recovery. And finally, contributing to and promulgating on a community portal for curation and sharing of technology and GIS best practices. So this is a big goal. And I don't think you can afford to wait. I think you need to work locally where you are to begin to work on your geospatial game plan, and then connect with this community and tell us what you need. Here's just a quick example. From the beginning, they began to form the early skeleton of the geospatial game plan, or at least some of the key functional areas or core information needs. Many of these were discussed today. And they're helping to identify and document capability gaps. And so you can see here sort of a rough timeline going from June into September and ongoing. And so you can sort of track the progress here. At NAPSG Foundation, we are also standing up a community portal, not just for COVID-19, but to share a lot of the tools like you saw today in a one-stop shop environment that's connected to our website. And more importantly, what's next is we're working on a peer-to-peer community to promote networking and engagement. And finally, if you want to hear more, if any of this sounded interesting to you, sign up for our newsletter at www.napsgfoundation.org, and you can visit our events website. And most of these are virtual events for now, and they're all at no cost. June 23rd is our open community forum. I encourage you to register for that. And we'll continue on June 30th with hurricane readiness, and you can see some of the other topics coming up. And again, I'm biased, but I really think I'd like to extend the welcome into our community, into the public safety community. I'm sure we can learn from you, and I hope that you gain something in return. And with that, I'd just like to say thank you, and I would turn it back to Cassie. I don't know if we have time for questions, but I did want to say thank you all for your time and consideration.
Excellent, Paul. Thank you so much. Let me go ahead and grab the control here. We do have a couple questions for you. And let's see, let me share my screen here. Okay, so a question that came in regarding the early detections. What additional information was used for early detection that you can combine together with the 911? Do you know of any other early indications that you were aware of that was used?
So I know the Boulder example is just one example, and they are going to talk more about that next week if you want to join us. But also, there were other agencies trying to use computer-aided dispatch data, or we call CAD data, 911 data. But other examples I've seen are emergency room visits, right? So rather than waiting for a diagnosis that it is COVID-19, actually just looking at the symptoms that show up in emergency rooms was something that I know some agencies were taking advantage of. And I'd say otherwise, yeah, looking at case reports were the most common, but a lot of challenges there, right? You're sort of looking at what's already happened, and you're looking at it through maybe a lens that's really hard to track. I compare it to, in many ways, like trying to understand fish counts in the ocean by fishing, right? You're only going to catch them where you're detecting them, and that is very hard to do population counts off of that information, right? So, yeah.
Yeah, thank you. I would just like to thank you and all the work that NAPSG is doing to provide those resources out there, the community to community mentorship, and all the work that you do to provide additional information for students out in the field. So thank you very much, Paul, for speaking today. Very interesting material. I'm going to go ahead and kind of wrap up this session. I want to thank everyone for attending. Thank you, Martin and Paul, for being such wonderful speakers for part 2. I would love to invite you to enroll in our third part of our speaker series, which takes place on July 1st. And at this part in the series, you're going to be hearing from those folks on the ground, the boots on the ground, using geospatial technology to map a disaster as it unfolds within a pandemic. So as I mentioned earlier, we'll be able to send out all the resources that our presenters used today. We'll be sending up a follow email, so you'll be able to get those links. I appreciate the wonderful contribution in the chat windows. So a lot of great communication there. I've also provided my email address if there's any additional questions, and more information about the online Master's GIS program and GIS certificate program. So all that information is there for you. Thank you everyone for attending, and thank you, Martin and Paul.